So I've been on service for 4 days now. This is the 5th day. And before I go any further and tell you what's going on, we should know what a bone marrow transplant is. So it's not a very apt term. So more apt would be high-dose chemotherapy with stem cell rescue, because the quote-unquote bone marrow transplant is really two parts. One is the treatment, the conditioning regimen, which is typically high-dose chemotherapy, so high that it kills both the tumor cells and the normal bone marrow cells, and then rescue of the patient with stem cells, either from themselves, stem cells harvested before the treatment, an autologous transplant, a sibling donor, an allogeneic transplant, or a matched unrelated donor transplant, or MUD, M-U-D, transplant. So there's two components to this treatment, so-called bone marrow transplant. One is the treatment itself, and the chemotherapy, usually sometimes radiation, and the other is the stem cells, the transplantation of the immune system into the patient. And in some diseases that we treat, the treatment is really, the chemotherapy is really the primary treatment, and the stem cells are just a support measure. But in other treatments, we reduce the intensity of the conditioning regimen, and the stem cells themselves, the immune component, is large. So it's this two-pronged therapy, and it's very intense because the diseases themselves, the cancers of the bone marrow, are very can be very aggressive and obviously fatal by themselves. And then the treatments themselves, both the chemotherapy is very high dose, the preparative regimen is very intense. It would kill the patient normally without stem cell rescue. And then the transplantation of the immune system, often of another person, brings with it a whole host of problems by itself. So that's what a bone marrow transplant is.